Now let's understand the another topic of tuberculosis. People also call it in the short form TB with Mission Parivartan. So what is tuberculosis and can tuberculosis be cured or not? So let's discuss it. Tuberculosis is a contagious infection that usually attacks your lungs. It can also spread to other parts of your body like your brain and spine. A type of bacteria which is called Mycobacterium. Mycobacterium tuberculosis causes it. And can tuberculosis be cured or not? In the 20th century, TB was a leading cause of death in the United States. But today now, the most cases are cured with antibiotics. But it takes a long time. You have to take medications for at least 6 to 9 months. So how many types of tuberculosis? Let's go one by one. A TB infection does not always mean you will get sick. There are two forms of the disease, like latent TB. You have germs in your body, but your immune system keeps them from spreading. You don't have any symptoms and you are not contagious, but the infection is still alive and can one day become active. If you are at high risk for reactivation, for instances, if you have HIV and you had an infection in the past 2 years, your chest x-ray is unusual or your immune system is weakened day by day. Your doctor will give you medication to prevent active TB. So consult your doctor. So the another one is active TB. The germs multiply and make you sick. You can spread the disease to the other. 90% of active cases in adults come from a latent TB infection. A latent or active TB infection, can also be drug resistant, meaning certain medication don't work against a bacteria. That is called a drug resistant bacteria. Now here we go, the symptoms and signs of tuberculosis. But the latent TB does not have symptoms. A skin or blood test can tell you if you have it, okay? But there are some, just like a cough that lasts more than 3 weeks, chest pain, coughing up blood, feeling tired all the time, night sweats, chills, fever, loss of appetite, weight loss. If you have any of these symptoms, see your doctor. Contact to your doctor to get tested. Get medical help right away if you have chest pain, because it can also lead to the heart attack. Now it's time to understand the tuberculosis causes. Tuberculosis is caused by the bacteria that is spread through the air just like a cold or the flu. You can get TB only if you have come into contact with people who have it. So tuberculosis transmission, let's discuss it as well as also when someone who has TB coughs, sneezes, talks, laughs or signs, they release tiny droplets that contain the germs. If you breathe in these germs, you can get it. TB is not easy to catch. You usually have to spend a long time around someone who has a lot of bacteria in their lungs. You are mostly likely to catch it from co-workers, friends and family members. Tuberculosis germs, okay, not germs. Germs don't thrive on surface. You can't get it from shaking hands with someone who has it or by sharing their food or drink. Now let's discuss what are the tuberculosis risk factors. So here we go one by one. First, a friend, co-worker or family member has active TB. You live in or have traveled to an area where TB is common, like Russia, Africa, Eastern Europe, Asia, Latin America, and the Caribbean. You work or live in the hospital or nursing home. You are the part of a group in which TB is most likely spread, or you work or live with someone who is. This includes homeless people, people who have HIV, people in jail or prison, and people who inject drugs into their veins. So you can get it from there. Okay, so you are healthcare worker for patients a high risk of TB. Okay, so these are the associated factors. So you can also get it from them, from there. And you are a smoker. Now let's understand. A healthy immune system fights the TB bacteria. Okay, but you might not be able to fend off active TB disease if you have HIV or AIDS, diabetes, severe kidney disease, head and neck cancer, cancers treatments such as chemotherapy, low body weight and poor nutrition, medication for organ transplants, certain drugs to treat rheumatoid arthritis, Crohn's disease, and the psoriasis. Babies and young children also have higher chance of getting it because their immune systems are not fully formed. Your doctor will diagnose a TB with the help of your skin test, with the help of your blood test, with the help of your sputum test. So let's discuss this. There are two common types blood test for the tuberculosis. First skin and the second one is blood test. So skin test, this is known as a Montauk's tuberculosis skin test. A technician inject a small amount of fluid into the skin of your lower arm. After 2 or 3 days, they will check for swelling in your arm. If your results are positive, you probably have the TB bacteria, okay? But don't worry. But you could also get a false positive as well as false negative. If you have gotten a tuberculosis vaccine, the result can be false negative, saying that you don't have TB when you really do. If you have very new infection, you might get this test more than once. But the blood test, these tests also called a interferon gamma release assay. What? Interferon gamma release assays measure the response when TB proteins are mixed with a small amount of your blood. So those tests don't tell you if your infection is latent or active. If you get positive skin or a blood test, your doctor will learn with these tests, just like TB gold test, a chest x-ray or CT scan to look for changes in your lungs, acid fast bacillus test for the TB, people call it AFB. If I miss the pronunciation, then it's sorry for that. Bacteria in your sputum, the mucus that comes up when you cough. So this is what we actually gonna tell you. But if you are gonna find, and if you are trying to searching the treatment for the tuberculosis, I recommend you please consult your doctor first. She will tell you about the better treatment, best treatment for the tuberculosis treatment, diagnosis. But there are some few, you can take the medicine to overcome your tuberculosis, you can take the vaccine, okay? But consult your doctor first. Thank you very much for watching our video.